Before I closed down my lab, yeah, no, I was working on trying to make a universal influenza vaccine. Experiments all took place in the mouse, and I learned all about influenza in those 5 years that I was doing those experiments. It was interesting because we would inoculate the mice through we'd have them breathe in through their nose the virus down into their lungs, and that's how we infected them, and that's how we and also um, that's how we immunized them, and then we challenged them the same way. Yeah. So, and that's probably an interesting place to start, because a lot of people are wondering about the flu versus coronavirus,
Yeah.
and so why should we be so excited about the coronavirus as a major pandemic all over the world and so forth? Because a lot of people die every year from the flu. And the thing is, even though they cause the same syndrome, clinical syndrome, in terms of usually an upper respiratory infection, the viruses are two different viruses, number one. Number two, the coronavirus is absolutely new to the world now. In contrast, the influenza virus has been around since medieval times. And in fact, the name influenza comes from the Italian Renaissance, or in the 1500s. They had these mysterious epidemics that were coming and going, and they couldn't understand why. And the only thing they really had to go on was astrology at the time. And so the astrologers got together and they decided that a new epidemic would happen when all the planets lined up. And that happened. This is true. And when that happened, it was the influence of the lining up of the planets on the Earth that caused the epidemic. And so that's how it got its name of influenza, which is an Italian word, I think. In the 20th century, the flu vaccine was the first one after Pasteur in the 19th century. The first vaccine that we really had, and so we've been in our lifetimes, and particularly since World War II, the populations worldwide have been exposed to influenza. Either they get the infection themselves, or they've been immunized with different strains of the virus. So everybody's walking around with from exposure to the virus, and consequently some immunity. It may not be for the specific strain that is circulating this particular year, but for the most part, we're as a global population, we're better off from the vaccination. In contrast, the coronavirus being it's an absolutely new virus to the human population. And you have to realize that there's 7.5 billion people in the world now. And if 1% of the people get infected, that's 75 million people. And if 10% of them die, that would be 7.5 million. So those are the kinds of considerations that particularly the public health people are worried about, because the other thing about this particular virus is it seems to be extremely contagious. And the data from the cruise ship that docked in Yokohama is shocked me, because on February 1st there were 5 identified cases on the ship, and by February 15th there were 500.
Wow.
And in only 2 weeks. And I said to myself, this is a bad disease. And so consequently, the pandemic, as it came out of China, has spread throughout the world very, very rapidly. And so the thing is that if what I think is going to happen is that the hospital and the medical care facilities are going to be overwhelmed. There was a scientist from the University of Washington that was on TV yesterday who was talking about the issue, and he said, he was an epidemiologist, and he said, we have 1,000 cases I can't remember whether it's Seattle or the state of Washington. And he said from the first case identified until now, the virus, the number of cases has doubled every week.
Wow.
And so now we have 1,000 cases. And he said, if it continues to double every week, in 6 weeks, we're going to have 60,000 cases. And so you can imagine what's going to happen in the emergency rooms and the hospitals and so forth, even if only a fraction of the total people infected actually get clinical illness on the one hand, and also get serious clinical illness on the other hand. So that's a big deal, really. And it's really unprecedented in modern history, and we haven't had to deal with this kind of a situation ever before. So the other thing, the reason it's so communicable and so contagious is severalfold. One is that for sure, if somebody coughs or sneezes and you're in the vicinity and you're in close proximity, for sure, you might then breathe in those water droplets that would contain virus, and they would go into your nasopharynx and so forth, and through your mucous membranes into your body, and then you're infected. And that's one of the reasons that people are wearing these face masks. But the thing is that in addition to that form of contagion, the other thing that happens is that the person's hands, when they touch the doorknob or use the telephone in the office and so forth, that's what doctors, the objects, whether it's a desktop or the doorknob, the doctors have a name for that, and they call them fomites. Mm. And I told my wife, that's another one of those F words. And so, in a fomite, the fomites are the major problem, because if you think about it for a second, what are you going to do? I mean, everything you touch could be contaminated,
right?
And particular out into the outside world, if you leave your house or your apartment. And so, the only way to guard against that is really to stay home. Mm. And that brings another sociological, societal problem, because if everybody stays home, nobody's shopping, nobody's buying things, they're not traveling, they're not taking a taxi or a bus or an airplane, and for sure they shouldn't be taking buses anymore. So, and that's one of the reasons that I think that this particular epidemic is going to be very, very difficult on everyone, because even though it's raging and coming very fast, it's going to be around for quite some time. The history of the epidemic in China is that they first became aware of it on December 8th, and then they didn't really announce it to the rest of the world until the 31st of December. Right. And then once they knew about it and so forth, they told the city of Wuhan, that has 11 million people, that they were going to close the city down in 2 weeks. And consequently, 50% of the population left, and they populated all over China. And I've never heard of Wuhan before, but evidently that's a big business center. And so the air traffic in and out of Wuhan is, in particular to Italy and also to Iran, has been fast and furious. And of course, they were coming and going all through those weeks, 4 to 6 weeks, unperturbed, because nobody really knew what was going on. And so that's why we've seen cases crop up. Now it's March, or late February, March, cases have crept out all over the world. I think the last count, there was 80 countries. Mm. And certainly it's in the United States, and it's really, I think yesterday they announced that the 36 states had at least one case, which means to me is that it's every place.
Right.
And if it's, as that scientist from Seattle said, well, if it's doubling every week, it's only a matter of time before we have lots and lots and lots of cases in the United States. Even the flu is not innocuous. But the coronavirus, as they have said on TV, I'm sure everybody has seen, that they'd say, well, for the most part, most people get a mild or not a real serious infection. But if you're in the older age groups, then you're at risk for a serious infection. And coronavirus kills in the same way that the flu does. And that happens when it's usually the infections are in the upper airways, in the nasopharynx. And so you have cough and runny nose and so forth. If it gets down into the lower airways, down into the lungs, and the anatomy of the lungs is that the breathing tubes, the bronchi, it's like the branches of a tree. They go out into the periphery of the lungs. At the end of the breathing tubes are little air sacs, and there's just bajillions of them, lined by only one layer of cells before the blood capillaries are, coursing throughout these air sacs. And so that's how oxygen and CO2 are exchanged, through this one layer of cells of the lung and the capillaries in the blood. And when the virus infects those lung lining cells lining the air sacs, that's not so good. But even worse is the fact when the immune system then recognizes that there's an infection in those cells, it starts attacking the cells and trying to kill the virus. So it kills the cells, and it releases molecules that cause the capillaries to start to leak their plasma. They leak their plasma into the air sacs. The air sacs fill up with fluid. And ultimately, and it becomes disseminated throughout all the lungs. It's just not in one area of the lungs. And so basically you fill up with fluid and you drown. And that's why you die. And the problem with that is that we're no better off now than we were in 1918 when we had that really bad flu epidemic, when people were, and it's described in the books, where people would be absolutely normal and walking around and going to work or whatever their daily activities were. And within 24 hours, they were reporting to the emergency room blue because they couldn't exchange oxygen. And the same thing is happening with that's the reason people are dying of the coronavirus now. And the other major problem is that the mechanical ventilators don't work. What they do is, you put a tube down into the trachea, and you force air down through the breathing tubes, and so that can go through the bronchi, but the air sacs are filled up with fluid, so there's nothing you can do about that, and so mechanical ventilation won't work, and that's a major problem.
Right.
So not only that, all of the intensive care units and the mechanical ventilators all over the country are already really in use. You don't see too many empty beds in the ICUs these days. And what I've decided to do is undergo self-quarantine as much as I possibly can. But even that is difficult, because after a while you run out of supplies and you have to go out to the store and whatever else. And as soon as you go out into the community, everything you touch is potentially contaminated.
Right.
And then if you have there's a long incubation period by the time you become infected until the time you start showing symptoms, and that's why the quarantine period is 14 days to identify whether you are going to be come down or not. So in the end, there's really not a whole lot you can do other than reducing all contact with people that is unnecessary. That's first of all. So cancel all those, beauty appointments and so forth, unless you really need your haircut. and everything, and cancel all social engagements and stay home as much as you can. And then if you do have to go out into the world, what we've been doing is that we've had a supply of exam gloves, the rubber gloves, the latex gloves, disposable ones.
Yeah.
And so I'm taking them with me wherever I go. And if I have to touch something that I don't want to touch, I put these gloves on. and then discard them after I'm done with that particular interaction. So I think that's the best thing you can do.
So what I've heard sort of two various competing trains of thought about the face masks. One is that don't buy them because you're going to mess with the medical supply chain where hospitals need these and whatnot. And two, they don't work only if you've actually already got the disease. It prevents you from breathing on other people. But I don't know. What is your educated opinion on wearing one of these?
Yeah, the only thing that they will stop are aerosol droplets, actual water with viruses inside of them, getting through from the outside, and also if you're already infected, going to the outside. And what they're recommending is don't use them unless you are yourself infected to prevent. And I suppose they're putting them in all the patients in the hospitals and so forth. And so, but they won't stop virus that is not in a water droplet from coming in, or the whole fomite problem.
Right.
And so yeah, it sort of gives you a false sense of security, probably. But you're not okay if you're walking around with one of those, unless you also are very conscious and cognizant of the fomite problem.
So the short answer is don't breathe and don't touch anything.
Yeah. So I've been telling people to just go home.
Yeah.
Go to bed, pull up the covers, and stay home and make love.
Well, that sounds like a great solution. Just hope the other person doesn't have coronavirus.
It might be therapeutic, you don't know.
Everyone will, all marriages will be saved, and everyone will be back out of their neuroses.
Yeah, you're probably going to have a big bump in childbirths in 9 months. The AIDS epidemic, the HIV epidemic, is a case in point that speaks to this very question, because all of a sudden the HIV virus came along and so forth, and it took. And in that instance, the history is that they first became aware of the virus in 1983. And it wasn't until 1995, 96 that we had new drugs that had been discovered and had been then clinically tested in people, shown to be safe on the one hand and efficacious on the other hand. Those are the two things that have to happen, and that requires testing in humans. We're first testing in animals and then testing in humans. And all that testing of once you identify a potential drug takes a long time. It takes months and years to come to the situation. And so this, as a consequence of the HIV epidemic, the FDA changed their rules and allowed the swift approval of a new drug if anyone could show simply that it made the virus go down a little bit in the body. Before that, they required for approval, they required data that you either prolonged life or improved the quality of life. So those were so-called clinical endpoints that took even longer to get to. So if you extrapolate from the HIV situation to now, I would say it's going to take, unless there is a drug that's already in the formulary that is in use in humans for some other indication that is found to work on this particular virus. And that's the other thing, each bug is different. And so usually the drugs that are out there will only kill a certain kind of bug or kinds of bugs in the same family. And so since this is a new virus, it's in the family of coronaviruses, and evidently there's a lot of those different coronaviruses. But as far as I know, we don't have drugs that are in the formulary already for coronaviruses. So I think discovering one that's already there that might be useful for this is a stretch, and it's not going to happen. Which means that we have to identify new drugs, new compounds, new kinds of things that might be effective for the virus. And that's going to take years. That's not going to happen in weeks or months. So that would be for therapy for people who already are infected. The vaccine is a very similar kind of a situation. I can remember back in 1983 when Bob Gallo had, through a press conference, and he had the Secretary of HHS by his side when he triumphantly announced to the world that he had discovered the HIV, the AIDS virus. And of course, it came out a little bit later over time that he really stole the virus from the French. They're the ones that originally isolated it. And that's one of the reasons he just didn't write a paper about it, as would be standard in science. He threw a press conference. And of course, he was working, he had a big laboratory at the NIH. Anyway, so he said, it's no problem. Now that we have the virus, we'll have a vaccine in 3 months. Well, that was 1983. And so now it's almost 40 years later and we still don't have a vaccine.
Wow.
So each bug is different, and whether or not you can get a vaccine to it's dependent on many different kinds of variables. And so I don't think we're going to see a vaccine all that soon either. And so what the public health people are predicting with regard to this particular virus now is that it's going to run through the globe and infect a lot of people, and some people will die and so forth. But then it's just going to be, it's just going to live with us, and we're going to have it, and it's going to be around all the time, and so forth and so on. It might, whether it's seasonable or not is another question. It's probably not. And even now, I don't think people know why influenza seems to come on in the winter months. Whether it's because people are more inside and close together, or whether or not it has something to do with the virus itself. I don't think it's a given that this is going to be a seasonal virus that comes and goes like that. I think there has been a recent paper out that came out in Nature about a month ago now from the NIH, from their vaccine center down there, and it didn't have to do with viruses. It had to do with tuberculosis. I think it can also be used for flu and also for coronavirus. And that is what they found. We've had a vaccine since 1924 for tuberculosis.
Right.
And it's called BCG, which stands for Bacillus calmette-guerin. And Calmette and Guerin were two French investigators working at the Institut Pasteur in Paris. And they cultivated a strain of tuberculosis that somebody had isolated from cows. And they worked it up and worked on it for a long time, and were able to show that if you gave this live bacterial vaccine as into the skin, that it would work to prevent them later on tuberculosis. But the efficacy of the vaccine was not the greatest. It was adopted all over Europe, and everybody in Europe has received this BCG vaccine as children, just the same way we used to get a smallpox vaccination, and now that we get polio and mumps and measles and so forth. In the United States, the tuberculosis the incidence had been decreased around the turn of the 20th century just through cleaning up the environment and public health measures, so that our incidence of TB was not as great as it was still in Europe. And we never adopted the BCG vaccine because people said, well, it doesn't work very well. Well, TB is still a major killer all over the world. And what the NIH investigators did is that they, rather than give the vaccine in the skin as an injection or what they called it a scarification, they compared that route of vaccination with the same number of bugs, the BCG bugs, given intravenously. Now, if you give it intravenously, where it goes is it goes in the venous system up into gets dumped into the right side of the heart, which then pumps it into the lungs. And since that's where you want to have the immunity, what they found is that then if they did these experiments in mice, and I think also in monkeys, if they then challenged the mice with TB rather than the vaccine, it was 90% effective. And then when they looked in the lungs of these of the animals and so forth, they found them chock full of those very good cells that are called T cells that I've been studying for 45 years or so. And so that's one of the reasons I like that story. Because I think it's obviously, it just goes to show you that if you give it where the infection is going to be, it will recruit the immune cells to come and sort of be there as a standing army if and when the invading army comes in terms of the microbe. And so it has obvious implications for a flu vaccine on the one hand and a coronavirus vaccine on the other. And so if I were still working, that's exactly what I would work on if I wanted to work on coronavirus.
Yeah, I feel there's an opportunity for some scientists out there right now to really do something very interesting.
There's a great book that's called Advice to Young Scientists, written by Sir Peter Medawar, who won the Nobel Prize in 1960 and for figuring out that there was such a thing as self-tolerance, and so that the immune system recognized non-self, and it also recognized self. It recognized non-self like a bacteria or a virus, reacted against that. But then it also, if it recognized self, it did not react, and he got the Nobel Prize for that. And his advice to the young scientist was that you can be successful in science, but to be successful, you really have to work on something that's important.
Right.
And so I thought about that for a while, and I said to myself, well, who decides what's important? Well, in this instance, and that's one of the reasons that I started working on cancer when I first started working, because I thought, well, that's important because a lot of people are dying from that. And obviously, coronavirus is important because everybody's looking at it now.
Right.
So there you go. Well, when I was in that kind of a situation back in the early days when I first started out, I realized early on that I needed to know how to do the experimental procedures in order to get successful experiments and so forth. And I also realized after failures and so forth that you can get the recipe for the experiment, and you put A plus B and look for C or something of that sort. But how you actually, accomplish that, how you put the experiment together, took skill, and there were experimenters in the world that were better than others. And usually the person who originated the whatever the technique was was really the world's expert. And so what I did when I wanted to set up a new assay in my laboratory is that I contacted whoever it was that was the world's expert, and I asked them if I could go to their laboratory and look over their shoulder and figure out and talk to them and figure out exactly how they did this thing. And then once I did that, I would go back to my laboratory and see if I could reproduce it, do it just as well in my laboratory as they already did in their laboratory. So that's the advice that I would have for young persons starting out in this business. And so with regard to coronavirus, we're going to have to go to the people who know an awful lot about coronaviruses at this stage. The one thing about the coronavirus that sets it apart from other kinds of viruses is the highly contagious nature of this virus. And I also I went into detail about the problem of spreading the virus around through fomites or anything that is a solid surface or objects such as a doorknob or a tabletop or whatever. In addition to that, people can be contagious even when they're asymptomatic before they begin to show signs of infection, such as upper respiratory symptoms such as a runny nose and cough and that sort of thing. So they can be walking around the community and doing their normal daily activities, and they can be releasing virus that then attaches to fomites, and then you come along right after them and open the same door or the doorknob, and touch the same doorknob, and then you can then introduce that virus into your through your mucous membranes of your eyes, of your nose, or your mouth. And that's why the guidelines that are out there in the news and so forth is to continue to wash your hands all the time. But what they don't seem to be telling you as to why you should be washing your hands. And the reason is because the virus is being deposited on all of the solid objects around them. So the other thing that I've just learned actually this morning, reading about past outbreaks of coronaviruses, such as the SARS and the MERS, is that you can be still contagious even after your symptoms clear. And that can last up to 3 weeks after you are no longer asymptomatic. And so that's one of the reasons that this virus is spreading so rapidly. So one of the problems with the current coronavirus epidemic in the United States is the fact that we haven't been testing our population for exposure and infection by the virus. And so it's been an ongoing saga that has been going on since like the 1st of January, when the world was first told by the Chinese that there was this new virus circulating. And the CDC, which is the branch of our government that usually develops these kinds of tests, did work on the test and released it towards the end of January. However, they had to recall the test because it was giving false positives. Now, in the meantime, the bureaucracy at the CDC and other public health laboratories have impeded the development of the test by other individuals. And there was just an article in the New York Times on the front page on Wednesday, March 11th, which details what happened in Seattle, Washington, when a virologist who was running an experimental study on flu ultimately developed her own test and tried to apply it to nasal swab samples that she had collected over individuals over the last several months. And the CDC would not let her test those because she had not been approved to be a certified clinical laboratory test place. So I recommend that you read that article because it tells a little bit of the story, but there's also another story that happened at the CDC that nobody has been told about yet, and that is why did their test that they initially developed have flaws in it. And so those are the things that have kept testing. Essentially, we've only tested several hundred individuals in the United States, and so that's allowed the populace, the population, as well as the officials in our country to not become terribly interested in this particular epidemic because they have been able to say, well, we don't have it here yet. And so that's been a major problem. And what is predicted by most people who follow these kinds of things is that it's the number of cases, once testing begins in earnest, is going to go up exponentially all over the country. This morning, it was announced that now there are now 38 states who have reported positive cases. And so it's just the beginning of an awareness about what has been going on probably in our country for at least the last 3 or 4 months.